Hello, my name is Carlota Campos-Araneda. I am a registered nurse. I have been with Baptist Health for 5 years in April. So a few months back, I was coming into my shift, and the night shift nurse, she was giving me a report. And as she's giving me a report, she mentioned to me that, based off what the diagnosis might be, it seems like he might miss his son's birthday. And we were both pretty sad about that for him because we try to feel for our patients as much as we can. Afterwards, he unfortunately heard what the doctors had told him and what the next steps would be, which would mean that he was not going to make it to his son's birthday. I asked my supervisor, my manager, I said, hey, I told him what was going on with the patient. This is what's happening. He wants to celebrate his son's birthday, but he's not gonna be there, unfortunately. Can we decorate the room? So I offered and I said, can I go ahead? I can buy some stuff, I don't mind. And he said, no, don't worry, we're gonna get this all figured out for him. And later on that day, I met up with the person who coordinates events, and we went and we were talking more about it, and we were getting decorations.
My manager received an email from the unit where they were explaining that the patient was going to go through a procedure. It was his son's birthday that weekend, he was going to miss it if we could do something small, and just kind of gave us guidelines that he's into like Captain Underpants and stuff like that. And because I have kids, I'm very familiar with the books and the movie.
And we went ahead and we told him what the plan was. We said, we know you're not going to be there for your son's birthday, and we know that you're not going to be here for the party, so we can celebrate his birthday here in the hospital, and your patient's in the room. And the patient and his wife were in disbelief. They immediately started crying, and it was very emotional. It was very nice to see, how touched they were with just a small little intention of wanting to celebrate his son's birthday.
So we just started brainstorming. We came up with different gifts. Our volunteer department, they came up with coloring book. So they printed a bunch of coloring books. They made its own cover, put the child's name on the front. We ordered a cake, and then we're like, well, what else could we do? It'd be like, it'd be funny if somebody could dress as Captain Underpants. So because I suggested it, I was volunteered to kind of do it. And it was fine and everything, because it was for kids. I'm a dad, I understand those situations.
Who is it, buddy? Who is it?
Just one of those things, as soon as you knock, and I just saw the smile on the kid's face, and he was so excited. For me, it was I didn't really pay attention to anybody else who was in the room at that point anymore. It's like they weren't all there. They were there to see it, but it was more like a movie. They were just viewing it. It was more the interaction was with the kids and the patient himself.
Happy birthday, dear James. Happy birthday to you.
At Baptist Health, we like to be the warmer side of care, and to me, that just means warmer, not just because it's Miami and it's hot outside. It's just little things. Even when you think it's not doing a difference, it definitely can. And treating people as if they are a person here, and you have to remember why they're here and how it could affect us, and not just us, it could affect them. And just try and provide as much care in different ways, because care can go very far.